Dr. Dani Rabwin, bringing you Ready, Vet, Go, the podcast. And I'm really excited for my guest today. We have Dr. Morgan Stoddard. Thank you so much, Dr. Morgan, for being here.
Hi, thanks for having me. Excited to be here and chat with you.
Yeah, me too. I know a little bit about you, but really not very much. And I'm always so curious about people's veterinary journey and how they got to where they are. And I'm wondering if you can just give me a little bit of background about you and your bio and how you came into veterinary medicine. And then we can dive really deep into the juicy nitty-gritty of your career.
Love it. Honestly, this is probably one of my favorites and eye-opening things in vet school. Also, I apologize. I've got a cat in the background. He's yelling. He wants to go on a walk right now. And
it wouldn't be interviewing a veterinarian if there wasn't a cat in the background.
I thought it was so fascinating as a vet student to hear everybody's, interests in veterinary medicine, but yet how their career played out. It was very eye-opening to realize, hey, I didn't have to know what exactly I wanted to do in vet school. It's going to morph and change, as do many aspects in life. And I just thought that was super fascinating. And so my kind of background in veterinary medicine truly started with Dr. Gershon and the Canyon team. I think I started shadowing when I was 14 years old, maybe 15 years old. I was a fly on the wall. I would just come and observe for hours. I thought it was so fascinating. And in high school, that morphed into a little high school internship so I could get some experience hours. And we may have a special guest cameo here. We've got Squid.
I love it.
I'm going to hold him so he
I love it.
Hopefully pipes down for us. This is Squid.
Squid, you're so cute.
This is his
He's wearing an outfit.
Sweater. Yeah, he's all dressed up for today.
Oh, it's really cute.
I actually went to the University of Illinois. I graduated in 2020, which was very interesting.
Yeah, I'm definitely going to want to hear more about that.
Very interesting. I've actually never had a graduation. I did early entry into U of I. And so I kind of just skipped my senior year of undergrad. And then we had the 2020 COVID pandemic. So graduation was over Zoom. So I kind of joke somehow I'm here as a doctor. And yet I've never had a graduation since high school. It's very odd.
Wow.
But in vet school, I definitely was more passionate about small animal medicine. My fourth year during rotation started to have a little bit of interest in emergency medicine and critical care. And then I ended up taking a job. I'm originally from Southern California. So Illinois was a big transition, being away from family, coming to the Midwest. I always had this idea I was going to go back to California and practice medicine there and be around my family. And I ended up taking a job opportunity in Illinois, about 30 minutes outside of St. Louis. It was a kind of mixed general practice emergency after hours center. And so I worked there for about 3 years. My first 2 years, I did solo overnight shifts. After 10 p.m., there was not a doctor there. So that was a very eye-opening experience. I learned a lot. I truly flew by the seat of my pants a lot of the times there. And then I actually transitioned to doing some general practice during the daytime, still seeing those emergencies for about a year. And I just realized I really miss emergency medicine. I think that's my passion in vet med. And so we had a new hospital opening in the St. Louis area that I kind of jumped ship to really focus on. I was looking, truthfully, I just wanted more. I wanted more mentorship. I wanted more teaching and training. I wanted more opportunity. And I felt I kind of capped out at my last practice and it just wasn't making me happy anymore. Totally went through burnout and was just I got to move and pivot and do something different. And so I started working for VegER for Pets here in St. Louis about a little over 2 years ago now. I did about a year and a half, about 2 years of just being an emergency doctor full time. And now I've kind of pivoted into like a hybrid role where I'm still on the floor, but I'm also doing some leadership, kind of new endeavors, new adventures. So it's been an interesting 5 years out of school. I definitely never would have pictured where I'm at now. Like, if you asked me my first year of vet school, you're going to be in St. Louis as an ER doctor, also doing leadership, I'd be like, you're crazy. There's no way. Absolutely no way.
Isn't that it's just one of the amazing things about this profession is, you have this idea of being a vet when you're young and when you started shadowing at 14. And it's just so incredible the ways things can move you in different directions. And our degree, it's not limiting at all. It's very freeing. There's so many things that we can do in this profession and with this degree. And just to hear everything that you've done in the past 5 years, I cannot wait to hear even more about this journey. I have so many questions about just that first year out and you taking a job right during the pandemic. And you said you took a job which was working nights solo. With Ready Vet Go, I work with, just numerous new grads. And one of the things that I find that is a common theme that new veterinarians struggle with is confidence or lack of confidence. And to me, it seems like you'd need to have some confidence to be able to do those on your own, or at least fake it till you make it. What was it about you that led you towards this job, and how did you navigate as a new grad being in that role?
Yeah, I think knowing what I know now, I wouldn't necessarily change what I did in the past because clearly it's led to where I'm at now. But as we have new doctors in our practice and I'm trying to like mentor and support them, I think mentorship is the key to helping this profession, like in the longevity. And I'm just like, I can't believe I did that. And so I think one, like, I really feel like maybe part of it was trying to prove to myself that I could do the hard thing. I think that was a big part of it. Like, I had kind of gone through this like tumultuous part of my life. And I think I was trying to prove to myself that I could do the hard thing. Like, nobody else wanted to do it. I did have a doctor that I could like reach out to overnight and like call if I had case questions, but it was very rarely somebody in the building to run cases by or like put hands on the patient. So I did have a little bit of a lifeline. It was not, truly like structured mentorship like a lot of programs do. I very commonly had 5 textbooks, then just all my resources open in the office. Like, I have Snapchats that pop up on my memories of just strewn data everywhere. Like, holy cow. I relied really heavily on my nurse support staff for confidence. I could not have made it through that period without them. Truly, I had some amazing individuals that I'm still in touch with that truly got me through that period of time. And I think I would have truly struggled a little bit more had I had more face-to-face interaction with these clients. With it being COVID and everything being curbside, I kind of a little bit had the luxury of being able to like take the pet in the back, do my exam, go look up a bunch of stuff and, come up with my diagnostic plan, my differentials. I had a little bit more, I didn't feel guilty like stepping away to go investigate that. And I didn't really have to communicate that with the client at the time. So that was kind of my sneaky way to, get through that period. So
I think that's such an interesting perspective, because that is something that new grads struggle with a lot is, how do I excuse myself from the exam room gracefully so I can go look something up or ask a question of a mentor or someone on the floor? And you guys who graduated in 2020 didn't have to go through that. And that is like an interesting sort of added bonus, if there was one, from transitioning from school into practice during that time.
Yeah. I felt like it was a bonus, and it allowed me to build a little bit of confidence through that time frame, which then when I was so nervous to start seeing clients face to face. I think all of that like imposter syndrome resurfaced of, oh my gosh, like,
Yes.
can I do this? I've been practicing for 8 months behind a wall, just
Right.
talking to them on the phone, figuring out how to like conference call people. And
Right.
that I was really nervous. I was really nervous to start practicing in front of clients. And it's just so funny to me that that's where I started. And now I do absolutely everything in front of my clients, and it doesn't even bother
Yeah,
me.
you're at Veg. You're just like open
I'm
concept. You're
like,
doing
I
everything
do
in front of
this.
them.
Yeah. So
One thing I noticed, I had a new grad who was working in the practice where I was working in 2020. So she graduated the same time you did. And we shared a doctor's office, and we were, of course, curbside. And so I heard her on the phone all day, every day. And she would do the same thing that you did. She would have the time and the luxury of time to look things up. And the other thing that I noticed is nobody ever asked her how old she was or if she was old enough to be a veterinarian, which happened to me all the time as a new grad and happens to loads of new grads because you just look young. Not you, Dr. Morgan, just
yeah.
new grads in general often look young. And that I think can kind of like, eat away at the confidence a little bit sometimes when you're asked that constantly. So I don't know if that happened to you or if once you transitioned into seeing people in person, how that dynamic changed going from curbside and everything over the phone to then seeing people in person.
It definitely happened eventually. I think that luxury of, I can't remember if it was like 6, 8 months where we were curbside. I never got asked that question. I can't recall being asked that question ever. And when we started seeing clients face to face, I've like throughout my adolescence kind of always got asked, how old are you? Are you, I was expecting it truly. So
Uh-huh.
I did have some phrases that I had already kind of thought about of how I would tackle that when that day came. And like my favorite go to is, oh my gosh, thank you so much. Like my skincare routine must be working. And then I just move
I love
on.
that.
So it did happen, and I was anticipating it to happen. I would just kind of say a silly phrase like that, move on. I didn't let it kind of let me skip a beat.
I think that's really empowering. And I always encourage veterinarians to do what I call steal phrases because so much of the language that I use, I've been out for over 20 years, but some of the words that come out of my mouth are the words of my mentors and the people that I shared a doctor's office with the first year out in practice. And I'm always encouraging new grads to steal phrases from each other. And that's a really good one. So for new grads and early career vets who are listening, that if that feels authentic to you,
Yeah.
add a little bit of humor. Thank you for, my skincare routine is working, and it just kind of like lets it roll off, and then you can get right back to the business of being a doctor, which you are.
Totally. And going kind of off of stealing phrases, that is something that is my favorite thing to do. Is I love to just be a fly on a wall and hear how other people kind of tackle tricky or like sticky or just silly situations and how they navigate that. And I have over time built up my like repertoire of phrases I'll use to like get back on track, make myself feel better at the end of the day. And like half of these phrases, like I did not come up with these. I stole them from other people. And I think that's where
Yeah.
mentorship and just helping support these young doctors in their early career can be really helpful. Like one of my favorite phrases is, I'm just the recommender and you're the decider. I think that is
Oh,
such a good one, especially for emergency medicine where, you could be doing this like big extensive workup. The pet may be really, really sick, and there are so many different limitations that each customer may be impacted by, whether it's finances, logistics, they live 2 hours away, like all those things. And so I think we feel a lot of pressure in ourselves to be responsible for the outcome of the case. And so by saying, hey, I'm just the recommender here, I recommend these for these reasons, but at the end of the day, you're the decider and I'm here to support your decision. Boom, pressure's off. It's not my decision at the end of the day. So that's just like one of my favorite phrases. And I try to help get the new docs to, find out what their go-to
I
may be.
I think that's a really great one because what I see in our profession is, obviously we talk a lot about well-being and the challenges that we have around well-being in our profession. And I think a lot of that, when I look at new grads and early career vets, it stems from this kind of attachment to outcomes or attachments to decisions that our clients are going to make on behalf of their own pets. And when a client makes a decision that is, maybe different than what I would recommend, we have the tendency to feel guilty or feel like a bad veterinarian, or feel like maybe the client isn't a good pet owner because they're not choosing what I am, advising them to do. And I like the language that you use about being the recommender, not the decider. You're the decider, because it kind of takes away judgment from both sides. And any client interaction that we can have where we're releasing judgment, either of ourselves as the clinician or of our clients as the decision maker, I think goes a long way towards well-being on both sides. And I like that. And I don't know if you feel like it comes across that way to your clients, but it sounds very kind to me, as a kind thing to say to somebody. And I don't know if you notice what happens in the room when you say that, how your clients feel. But to me, I love that phrase.
Yeah. I think it helps take the pressure off of, this doctor's not going to shove tests and treatments down my throat. Like I tell them we're here together as a team today for Pancake or Fluffy or whatever their pet's name is.
Yeah.
We're a team, and I'm recommending these things. You get to decide. I'll support it. If this plan is not feasible, like, we're going to come up with a plan that you and I are both hopefully comfortable with at the end of the day.
This is so important. I speak at vet schools a lot about the concept of shared decision making, which is a concept that comes from the human side. And we're talking about it more, I think, in veterinary medicine. And that team approach, and they call it a team talk, is really part of shared decision making. Were they talking about that in school when you were in school? Did shared decision making come up, or have you done any like reading on that? Or are they talking about it in the clinics where you're working? Because I hear a lot of that in what you're talking about.
I don't recall learning about it in vet school, and like that phrase, I'll be honest, is new to me as of today. I think maybe ways that it has come up in like the more of the leadership aspect is when kind of communicating with another individual, like getting their kind of buy-in and their not like their idea, but having them be a part of it, you can often kind of shape the outcome of a situation. So I'd love to truthfully know more about that. Do you have any like keynote talking points on that shared decision making? Because you've piqued my interest.
You already are embodying them. I think, I was practicing shared decision making long before I knew it was a thing. Loads of veterinarians have been, and you are too. There are key points that you've already demonstrated, which are curiosity. You have, when you shared with me the way you're communicating with the clients, you are coming from a place of curiosity to find out where they're coming from so that you can then, what I heard you say is kind of shape the outcome. And I think that's really important. We are the experts in the room, and we are the ones who have the evidence-based knowledge. We are not the one who's living day to day with the pet and know what's in the best interest of the pet or the family. And so combining these things and coming together as a team, we can kind of help shape outcomes that might be within the best interest of the family. And it kind of changes the language, so that when we talk about what best medicine is, it's not best being gold standard. It's best taking into account everything that's coming into play around outcomes for these patients. So I think some people do it really naturally. And the feeling that I get is that you already are. There's a name for it. And, I can send you articles on it and I do a talk on it. But it sounds like you're already kind of embodying that. And I want to know, like you were saying that you're using that more now in a leadership role. And I think this is so exciting. You've been out for just 5 years and you're already talking about being a mentor and being a leader and incorporating that into your daily clinical practice. So can you share with me a little bit about what that journey was like, getting into more of a leadership role and how you're incorporating that into your daily practice?
Yeah, definitely. So I've been in this kind of a hybrid role for about 6 months now. So I still do 4 or 5 12-hour clinical ER shifts on the floor. I also am helping my medical director instilling and kind of upholding like our company's like medical excellence as well as cultural excellence. And I think our company we have something called a manifesto. I know a lot of people say you drink the Kool-Aid when you're at veg, and I can assure you I've drank it. I think with the mentors I've had at my location, it really has allowed me to see people for people. I don't think I really enjoyed interacting with the general public before this current job,
Mm.
truthfully. I think there was a lot of, as a young doctor, kind of battling just all the things young doctors have to face in the general public. It wasn't a part of my job that I loved. Uh,
Mm.
and I think with getting to do things open concept, the transparency, just trying to be different and break the barriers of ER has really resonated with me. I love it. It feels really natural. It feels like me as a person gets to go do my job. I don't have to be somebody I'm not. And so I try
Mm.
to lead with that too. And, as we're trying to help obtain our doctors with our cultural excellence, that's the biggest part of it, just like the culture. It's an environment that's supposed to feel safe and supportive and collaborative. And so it's navigating all of those like tricky conversations. And ER is ER. You never know what's going to walk in through the door. Emotions are high. There's a lot of challenges that you face. And so, kind of my role that I'm helping my medical director in is, giving coachability and feedback to people in a kind way and leading with love. And I've really enjoyed, as we've had like new graduates work through a program at our hospital, is just helping them hopefully have a better experience than I had myself. There were definitely
Mm-hmm.
like pros and cons to the experience I had. I want them to feel more supported, to help shape the future of their career. Um, so
I love what you said about leading with love. Is that something that you guys talk about in the clinic, or is that a Dr. Morgan
that's something
statement?
our like leadership team talks about a lot. Is anytime we give feedback to somebody, the goal is, you know, without sharing this feedback with you, it may actually be doing you a disservice in the future if we just kind of like held this within because it's uncomfy. And so when we have to tackle that feedback and try to help you grow and learn, tackling it from a place of, I really care about you, and these are the reasons we're bringing it up, and like, let's help you. It's not just like, oh, here's your feedback, moving on. Like, we're gonna help you like get through
Yes.
that and come up with a strategy of how to achieve that. Because I mean, truthfully, I think the first time I received feedback about how I was interacting with the team and maybe not the best way was probably 3.5 years into my career as a veterinarian. I was flabbergasted. Nobody had ever given me feedback before. I was like, please, somebody tell me how I can do better. Give me feedback. I never got it. And so the first time
Yeah.
I received like actual like critical feedback, my mind was blown. It was not the easiest thing to hear, but it was in the most supportive way, and I'm like better for it. And so I always have that in mind when sharing feedback with other people is, these people may have never ever had feedback before in their entire lives. And so that can be very life changing, for the better or for the worse. Like, if you don't deliver
It can. Yeah. If it's not done in, kind of a skilled way, it can be damaging. But I think more often than not, it can be a real positive thing. And it's hard for people to give feedback. I love that this is part of the training that you're going through, both as a leader, and it sounds like when you were an associate there, being on the receiving end of feedback, that is part of the culture. And it's coming from a place of love and helping boost you up as a team member. And, I just think it's something that isn't talked about enough. You said you went for 3.5 years without ever being on the receiving end of feedback. And, that seems like a long time. And I guarantee there are, people who have gone for years longer. I was at a clinic for many years where years went by, where I just wasn't receiving any feedback. And, if it becomes part of the culture, it can really help everybody grow and become better in their roles. And, I love that that's something that you're getting training on in this early part of your career.
Yeah. I think it's helpful
So,
too with the new graduates. I really do try to put myself in their shoes. I feel like I've been there. I'm still, I feel like, a little bit close enough in age, like when
yeah,
I graduated. Really try to put myself in their shoes and reflect back on kind of my experience. And I want to be the mentor that I wanted
yeah,
at that point in my career.
yeah. I love that for you. And I love that for your mentees as well. I want to dive deeper into something you said about some of the training that you're receiving in your current role is helping you enjoy interacting with clients more. That you said initially that wasn't something that you loved in your career. Correct me if I'm rephrasing this incorrectly, but what I heard you say, or what I thought I heard, is that isn't the part that you necessarily loved, and now you really enjoy that part. Can you talk more about that?
Absolutely. I think the majority of it is kind of the not so normalness of the company veg and doing things the veg way. I think in my last job, there was a lot of barriers. I think when um, just kind of taking the pet like in the back heightened some individuals' concern for their pet's care, kind of their level of just maybe distrust from past experiences weighed into it. I find, honestly, that doing things in front of the client, showing them the POCUS ultrasound I do on many, many pets, showing them the blood work, showing them the x-rays, like have just being transparent. Like I truly on shifts, I'm like, I don't have anything to hide. Like if you want to record me,
Yeah.
record me. I don't care. Like I
Yeah.
am who I am, and these are my recommendations, and I'm gonna treat you like anybody else walking through the door. So I think a lot of that, if we can be like a little bit more transparent with our pet parents, I think that does alleviate a lot of kind of that mistrust potentially coming in through the doors, and also just like building a little bit more of a relationship. They feel a little bit more comfortable asking questions.
Yeah.
So
This sounds like it might feel very freeing.
oh, I feel yeah, it's very freeing, honestly. And I think with our motto is like helping people and their pets when they need it most. I think all of the things that have been shown to me from like the top to the support staff really embodies that. I feel like when I go into work, I can help pets and their people in the St. Louis area with whatever means that may be. Um, we can,
What a gift, a gift for you and for the other people who are part of that team, but also a real gift for the clients. Because like you said, it is a heightened situation. When we have pet parents bringing their pets into the clinic, especially into an emergency situation, emotions are high, tensions are high, and that is a recipe sometimes for, kind of heightened interactions. And I just think what a gift to kind of change that narrative. Most veterinarians do not have the opportunity to work in that environment that's open concept. And I love hearing you talk about how you get to be your authentic self. It sounds to me like it's, potentially it was a little bit vulnerable to open yourself up in that way, but you've really embraced it and embodied it. And I personally practice that way too. I don't think that comes naturally to a lot of people. It's vulnerable to be so open and authentic like that. How do you think somebody could take what you're learning and practicing in this open concept environment where you're really, the focus on the culture and even the client's well-being? How can somebody who isn't in that type of environment take that into their practice in a more traditional style? You're in the exam room and then you take a pet to the back. How can we embody some of what you're learning and move it into more traditional veterinary medicine?
yeah. In the transition when I knew I was going to be changing jobs probably that last month, I started trying to see if I could implement some of this in a general practice setting. At my last job, we had like laptops and we could pull up x-rays. I would take that in the room, like after we did the set of x-rays, and actually like show the owner, hey, this is the foreign body. This is what I'm concerned about. Just like giving them something visually to look at. I think instead of
Mm-hmm.
just like the medical jargon, you just get them like glazed over. Sometimes like you just see their eyes glaze over. So
Yeah.
I liked taking my laptop in and just kind of showing them, or printing out the blood work and having them look at it while we're talking about it. I started doing all of my examinations with the owners in the room. I think it's variable on if you're comfortable with having the owner hold versus having your support staff hold. I think that's totally up to the doctor's discretion, case selection, kind of what everybody else in the practice is doing. If it's not something that you're comfy having them hold the pet, like maybe they could just like pet their head or talk to them. I started verbalizing out loud abnormalities that I was finding with the pet, like, oh, hey, this lymph node feels a little bit big compared to the other side. Let's finish the exam and we can talk about if that's something we need to investigate today. Like, it just gets them a little, I feel like if you get them a little bit more involved, a little bit more purchase in just why they're there, I think that builds a little bit more of like a relationship to kind of open that door frame up a little bit.
Mm-hmm.
Eventually we had a ultrasound that we could wheel around the hospital. I ended up bringing that into the room and doing like a quick POCUS exam. So, I mean, I got a little creative with still like 4 walls to an exam room. We still had a back, like all of the procedures, diagnostics, blood pokes, like those things all happen in the back. But I found little ways to just kind of like bring that into that environment. And we do still have rooms at Veg for those like anxious nervous pets. So I still do that with them as well to like kind of keep them engaged and involved. And I think when you engage them, it gives them a little bit more purchase and why they're there and their pet's care. It makes them feel like they have a little bit more autonomy in it. I think
Yes.
the other thing is just building that confidence to have transparency with the pet parent.
Yeah.
It really boils back down to communication.
Always. Everything goes back to
Always.
communication.
Yeah.
There's so many great tips that you shared. I love these are small things that can be implemented in an exam room interaction with a client right now. So for somebody who isn't working in an open concept environment, you do what I call narrate as you go, which is talking through the physical exam. It's just such a powerful way to bring the client in, like you were saying, to make them feel like they're part of what's happening. It also shows the value of what we're doing. We're not just petting their pet. We're doing a really detailed physical exam that we've spent a long time learning how to do. And if you can narrate that as you go, and it's also, the example that you gave, I'm feeling that one of these lymph nodes is a little bit enlarged. I'm going to finish the exam and then we're going to come back and talk about that and decide if it's something that we need to pursue. How fabulous is that? You're making a note of it. You're continuing on with your exam. And these are, again, some of the phrases that people can steal because this is stuff that, takes practice and doesn't always come easy. And, I hear this, really skilled communication as ways to build trust with clients. And so it doesn't necessarily have to happen just in an open concept
Right.
environment. Bringing in the ultrasound. Awesome. Bringing in your laptop where you can show the radiographs, sending the blood work. All of these things I think are just such good tips. So thank you so much for sharing all of those. I think people can take
Yeah.
a lot from what you're sharing.
One of my other favorite things to get clients involved is if I hear like a really crazy murmur, or there's like a kid in the room who's just like, it's their pet. Like maybe it's just like
Yeah.
maybe it was a wellness exam. Like actually having them listen to their own dog's heart,
Yes.
their eyes light up. They think
Their
it's
eyes light up.
thing. I had a bird patient. Like I'm not an avian or an exotic specialist by any means, but their heart rates are really wicked fast, and it's surprising every time I listen to it. And so I had a client, I'm like, hey, do you want to listen to your bird's heart? And she's like, yeah. She could not believe how fast it was. So just
Wow.
fun things like that. It makes it more fun. I don't know.
Yeah, we need to bring some of the fun back, and
We need to
even in
bring
a
the fun
stressful
back.
emergency environment. This is a fun
Totally.
job. It is not
Yeah.
puppies and kittens all day,
Right.
but it is fun, and I like that you said that. I mean, there's there's a lot of talk about how hard this profession is, and it's true. It is very hard, and we're dealing with some pretty intense stuff on a regular basis, but it's also really fun, and we can connect with people and have those human interactions. And I love that you shared your stethoscope with an adult. I've never done that. I do that with kids all the time because it's so adorable. And like you said, their
Yeah,
little eyes get so big, like, oh, that's Fluffy's heart. And they love it. But adults love that stuff too. We get to do it every day, and it's a novelty for most people.
definitely.
And I think also doing those things, kind of for me, it keeps me on track of my why, which I think is what's, added to some of my longevity in this profession. And the why for me has to do with, connecting with people and building community. But, you can get so caught up in the daily grind that you kind of lose sight of the impact that you're having. And so interactions like that, when I hear you talk about it, you even light up as you're talking about it. That's stuff that you're putting like in your emotional well-being bank, because you're going to have the bad days. They're going to be hard. But, the more you can kind of build up with some of these really amazing interactions is going to like boost overall well-being so that you're better equipped to handle some of the more challenging times.
Definitely. And I would really suggest that all those little notes, thank you cards, little shout outs, if you get anything like written down, like keep those and keep them in a designated area. It's our company is doing like vet day. It's in September. And so I got the doctors a little engraved wooden kind of box that they can keep these in. Um,
Mm,
just so they have somewhere to like put them if they want to, because like you said, there are going to be challenging days, hard days. This is a very volatile, I guess, profession in some senses, depending on the day. There have been so many times I have come home and just felt defeated, felt like I had this really sad case, or I got yelled at, which is never fun. Just like silly stuff that happens where it just makes the day not fun, makes you, if you're getting to that point where you're starting to feel burnt out again, just looking like, what's my why? Why am I doing this? Like getting that box out and just going through those positive notes, because you forget about them. Like you are going to forget them. And it's not until I've like pulled some of these notes out and been like, oh my gosh, I remember this case like 2 years ago. Like, wow, that was
yes.
such a good time. And I remember my fiance, there have been a few times where I'm just like, man, I'm feeling really like down in the dumps. Like, I don't know if I'm not really wanting to go to this like overnight shift. It's just kind of sucks. And he's like, well, what's going to help get you through this? Like beyond like support from family and friends and all that. Very commonly it's get the box out and I look at it.
Oh, yeah.
Granted, I am an individual where I find a lot of value in like words of affirmation, like the 5 love languages. I'd encourage everyone to kind of figure out what is it that makes you feel appreciated, heard, and loved, because that's most likely going to spill over into work as well. And so I love words of
Definitely.
affirmation. The notes are very affirmative. And so that's helped me get through some like tough times. For other people, it's, quality time. Like they just want to go hang out with their buddies, after work and catch up. So I think getting to know yourself a little bit deeper as well, and what makes you happy and what makes you feel valued and supported can help navigate some of the kind of fatigue and burnout challenges too. I think that we
I think
all
that's such an important point. And the notes are so special, and the cards, many of us have kept those over our careers. I think that box, the engraved box that you're getting for your team, is just so thoughtful, and it's a way for us to keep those memories, and you can like fall back on them when you're having challenging times. I love that you're doing that. And I think it's also really great what you pointed out for people to understand how they want to feel loved and appreciated. And the 5 love languages really is kind of like marketed as a romantic relationship book, but it applies to everything. One of my best practice managers that I've ever had did a survey, or she gave handouts to the whole team, basically asking about our love language. And she would not have had any idea what everybody's, preferred ways to be shown appreciation was. And many people, it was words of affirmation like you. For a lot of people, it was gifts. Some people love a gift card if they're doing great one day, or, to be put their name in a drawing for a raffle for some tangible object, or a gift certificate for the movies or something. For me, it's quality time. And what that translates into in a work setting is meetings and check-ins with my team, which is shocking to my team. Most people don't like meetings, but I
Well, how can
need
you
that.
like meetings?
I need it. I need quality time. I love when the practice owner will come into my office and sit down next to me and ask how my weekend was, or even better, ask me how my son's weekend was when he was little. Checking in, letting me know that you care about me and my family, and giving me quality time. And that even flowed into staff meetings, because that was quality time with my team. And so everybody's way is different. And I think this is something that veterinarians can do without having it be motivated by their practice manager or leader. You can get to know that about yourself, and you can share that with your leadership. This is actually how I like to be shown appreciation. And you can do the same thing with what you were talking about before around feedback. This is how I like to receive feedback. I need feedback right in the moment, so please don't wait. Or I will be mortified if you give me feedback right in the moment in front of a technician. I will just turn into a puddle and die. So please save it until after hours.
Yeah.
And if you know that about yourself and you communicate that to your leader, you're kind of opening the dialogue for getting the kind of feedback and appreciation that you need.
Absolutely. Yeah, I think you got to know yourself first. There are questions like leadership can ask to kind of probe this. If you don't know it, I sent a little survey out to my team, kind of coming on like, how do you, wish to receive feedback and, appreciation. We got to do both. We can't do one and not the other. And I'll tell you, it was so surprising to get some of those surveys back. Like, I had a couple doctors that I was like, even my medical director thought, there's no way that they appreciate when we're like on the floor with them, like that quality time. They just, it's not that they don't like us being there. We just wouldn't perceive that as being like top of their list. Shocker, it was. So, you don't know until you ask.
Yep.
But I just remember, right out of that school, reflecting back and being like, I don't feel appreciated. And that kind of like stemmed in, like, I was feeling super burnt out, realized I'm not feeling appreciated, and realized, I'm tapped out here, time to move on. So I think it's so important as leaders and as, coworkers to really make the extra effort. Like, if you really enjoy working with somebody, like, tell them, show them.
Yeah. Yep. That is really, really good advice. And I hope that people internalize that. Let people know. If you appreciate them, tell them, because sometimes you just don't know.
Yeah.
So I didn't tell you that I was going to do this, but if you will humor me, if you feel comfortable, I told you I work with a lot of new veterinarians. And one thing that I find that new grads, you might have experienced this too, one thing that they really like to hear is mistakes that veterinarians have made and lived through.
Yeah.
I think there's a lot of fear among new grads, fear of trying new things, fear of doing procedures, fear of messing up. And I find that sometimes people will try and do things to avoid even putting themselves in the situation where they will make a mistake. And what I like to do is let people know, you're going to make a mistake. It's completely inevitable. Here's how we work through those mistakes, rather than try and avoid them altogether. And so hearing from people who are in a position of, having been in vet med and practicing for a few years, now in a leadership position, and you come across as somebody who's enjoying your job currently, and I guarantee there was a mistake or something happened that didn't go that well sometime in the last 5 years, and new grads definitely want to hear about that, and vet students. And I'll put you on the hot seat and just ask if there was one thing that you think of that you would feel comfortable sharing. And it could be a small thing, it could be a communication thing, it could be a big thing, a medical mistake, anything at all, if you are comfortable sharing a mistake with us.
Yeah, absolutely. I'm like, where do I begin? um, okay, like the first kind of two that pop into mind are surgical. And I think what's so interesting working with new doctors, like surgery is one of the very common things that they're just so overwhelmed and stressed about. Like, I think that pressure, I mean, okay, to be fair, surgery is a little scary, right? Like, you can get in there and not really know what to do. So there's validity in being nervous and hesitant. But I, before like nailing down the medicine aspect, I know a lot of new doctors are just like, oh my God, surgery. And so I
Yep.
personally really, really love surgery. It's my quiet space in the ER. I get to go in the OR and just kind of like block everything out. But there have been for sure some very scary times in surgery. I remember I was just out of vet school, probably like 6 months or less, and I took a dog to surgery overnight. I'm by myself. I have my nurse team running kind of like the ICU. I have one nurse in surgery doing anesthesia with me. It was, I believe, like a middle aged female intact dystocia. This
Mm,
doggy could not have her puppies. I don't believe she had any of them. And I did ultrasound, and the puppies were not viable, but there were numerous inside. I think if
mm,
I'm recalling, it was like 8 to 10 puppies, just
mm.
medium-sized dog, 8 to 10 puppies. Like, this wasn't like a Great Dane. This was maybe a small Labrador-sized dog. And I got in there. I had done like a C-section before. I'd done spays before, but I'd never tackled a dystocia like this, where the puppies were not viable. And I thought I could tackle it just like a normal spay and ligate the pedicle and ligate the broad ligament, and then at the end kind of like milk the puppy out and close above the cervix. That very quickly did not work out. I was in the process of ligating, massive hemorrhage unfolded. One of the broad vessels, the weight of it just couldn't take it. It ruptured. It's bleeding everywhere. I'm freaking out. It's gushing. Like, this is an arterial bleed. This is not a venous bleed. And
Wow.
I'm, trying to get a clamp. I can't really see where it's coming from. And it thankfully was close enough to the uterine body. I ended up just taking this like massive caramel and just like clamping across and like watching to see what happened. And I'm like about ready to freak out, like full freak out. Like, my heart rate is through the roof. I am
Yep.
shaking. I am not comfortable anymore. Like, I am not ready to tackle this. And at the time, I had a doctor who lived like 10 minutes down the road, and it was like maybe 11 o'clock at night, 11:30. And I called her and I was like, I'm in surgery. It bled a lot. I don't know how to tackle this. And she's like the most cool, calm, collected, like level headed person. And she was like, okay, like, do you feel that we can talk through this on the phone, or do you want me to come in? And I just remember being like, I need you to come in. Like, I got to the
Oh,
point where I realized I could not tackle it with the experience that I had. And
yeah.
it was so meaningful to have like a mentor be
Yeah.
willing to come in and help me with it. She didn't complain about it, like
Yeah.
coming in late. Like, I think she worked that day. Um, I mean,
Mm,
it felt so supportive.
yeah.
And it just, that surgery moment, thankfully doesn't happen again. We now know how to tackle those, but that was like super, super scary as a new grad.
Yeah.
I also had the dog did great, by the way. Puppies,
Good.
got him out. We ended up making an incision in the uterine body and just like taking all the dead puppies out so I had space to work was the solution to
Yep.
tackle the
Uh-huh.
abdomen. It was just way
Right.
too big, way too heavy.
Yeah.
And the doggy did great.
Oh, good.
Another kind of surgical error that happened was I took abdominal x-rays on a dog, and I remember this dog, the history was, we were vomiting, we were not wanting to eat, and we likely had a history of like ingesting a tampon. And so looking at these radiographs, there was kind of like this like circumferential mesh looking structure, almost looked like braided, and depending on the view, I got it in my head that I was like looking at the tampon, which is like really silly knowing soft tissue opacity and like you can't actually see that. But
Right.
it was, there was like gastroenteritis, so there was a gas pattern, and there was this opacity, and we did repeat rads, and it didn't go away. There's still gas. Granted, this was before I think we were able to send out like stat radiographs. So like this was my assessment, this was my recommendation, and I was like, I think this dog ate something, and I think this dog needs surgery. They went in, and it was a negative explore. Turns out the dog had a resection and anastomosis in the past, and they very commonly, if they use a specific type of a stapling device, can have that appearance in the intestines. So that was a really big learning experience. The owners were not mad, but with those situations, we do have to be transparent,
Yep.
um, and let them. I typically kind of tackle those with discussing like the findings in surgery. Like, at this time, we actually didn't find a foreign body. We did find, there was some gas and fluid, and we like ran the bowels through and through. There's no perforations. And then I think we ended up sending those x-rays out for a radiologist to interpret, and they came back with like previous resection and an anastomosis site. So I took it as a learning experience. I think when
Yep.
mistakes are made, one, being upfront and being truthful with owners, even though it's really, really, really hard. It feels uncomfy. Nobody wants, I don't like doing it. It's not fun.
Yep.
But I think having that transparency, letting them know what the game plan is moving forward. And if there's potentially like a learning opportunity or a teaching moment or something you can take feedback to the team, they really love hearing that. Like they want to know if their pet went through it, that it's not going to happen to somebody else's pet. And so that kind of
Mm,
alleviates so much like of the anger or the, oh my God, they're going to sue me. If you're honest and vulnerable and let them know how it's going to be rectified in the future, well, a lot of the times it's all people want, truthfully.
what a great, great message, because you could have gone so differently with both of those stories. I love that you had the support that you needed with that first one. That experience of seeing the abdomen filled with blood, the first time it happens, it's just, well, every time it happens, your heart rate just goes up and you just get so nervous. But I think having that experience and living through it so that there is a workaround. And even though you called your mentor in, that was amazing. You already stopped the bleeding before she even got there. By that time, she was moral support and gave you some tips on taking the puppies out. But you needed that for moral support, but you did the hard part on your own. And that's just such a cool story. And then the second story, there's so many lessons in there about how we can deliver this news, how we can communicate to our clients if we have a, quote, negative explore. There's so many other things that we learn by going into the abdomen. There's a lot of things that you learned. And the piece about sharing with the client, if you do make a mistake or the outcome isn't what we want, to be open and vulnerable and let the client know how we're going to make sure that this doesn't happen again to another pet. That's so powerful. I don't even know that I've ever really thought of it this way. They want to know if their pet went through something or they went through something, that at least something good will come out of that. What a cool lesson. Is that hard? Did someone teach you that, or where did that come from?
Um, I I think my previous medical director, she's like one of my most amazing mentors I've had in my career. Her and our hospital manager, like at my current job, and we've talked about, if we have a upset customer come to us, write a negative review, or they reach out, or they talk to the medical director. It's some of the feedback I've gotten of, hey, we talked about XYZ. How do you think we can prevent this from happening in the future? Is just something like we've talked about. And that's something I can't remember what our hospital manager's background was before veg, but it was not veterinary medicine. And so she has a lot of really insightful tactics on like conflict mitigation and
Mm-hmm.
more of just resolving like complaints and issues with people. So I think a lot of this came from her, honestly, because she always has like really insightful perspective on, put yourself like in their shoes. Like if they're going through
Mm-hmm.
this, what are they thinking? Because it's really easy to immediately get defensive. It's like the human response. I feel that too. Like if I'm looking up, one of my doctor's customer issues, I'm like, oh, like it's the natural response. But if you take a
Yes.
beat and you're like, okay, how is this person feeling? And what do I think that they want out of this? More often than not, it's not going to happen again. An apology can go a long ways. Sometimes it's they want their money back. Sometimes they don't know what they want, and you just have to ask them, like, what does resolution look like to you? Because
Yeah.
it's different for everybody. So if
Yep.
you're kind of navigating these like tough conversations and talking about mistakes, or like an adverse event, like if there's no fault but something unfortunate happened, like those are not easy conversations to have.
Yeah.
Explaining the process, explaining the why behind it, making sure that they feel heard and supported and are allowed to ask questions. And then at the end, like, you know, what does resolution look like to you?
Yeah.
Let them kind of
Yeah.
answer their own question. Sometimes they still don't know, but
Right. But they know that there's a space for them to feel heard, and you're, creating that open space for them. There's so many great lessons in what you just shared. I love that you're learning that and embodying that. I'm so wildly impressed by you. You've had, just 5 years in your professional career so far, and you're already doing so much and making such an impact. I'm just curious, you said you're not in a place that you expected to be when you were 14 and shadowing, or even necessarily in veterinary school. But as we wrap up, I just want to know, what does the future look like for you? You've got like pretty amazing things ahead of you, and you're on this leadership and mentorship journey now. You also sound like a pretty fabulous practicing clinician. What's in store?
that's a great question. I think about this like daily. I think for like my next 6-month goal truly is really honing in a little bit more on like prioritizing myself outside of work and prioritizing like family. I struggle with fatigue, and so it's this ongoing fine balance situation. And so I think before tackling any other like avenues of leadership in the future, like I really just want to hone in and focus on like me and supporting like my family, as well as I love my job, I love my team and supporting them, but I think it's okay to also like remind yourself that work isn't everything, even if you really love it. So that's like probably what my next 6 months looks like. I don't really know for the future. I still very much really love practicing like emergency medicine, surgery. I feel like I'm in kind of that like awesome balance right now between getting to do that and getting to do leadership. I don't know if at some point like it'll like tip the other way, if I'm like, okay, I've been in it for like 10 years now, I'm ready to like move on. I don't really
Yeah.
know. I guess we'll see, but
Yeah.
I really loved chatting with you, and I think you have such insightful experience, and I can just see how much you love working with like new doctors and like your early career doctors and like providing them that support. And I just love that you have this platform that hopefully other new doctors can find support in. And if anyone has any questions at any point, I'm always like happy. I can send you my email if people have questions and want to reach out.
Yeah, we'll make that available to people to reach out to you, because I think you're super relatable and have really practical experience to share and a lot of really good advice. I mean, this has been an awesome episode and an awesome conversation. Like, I've learned a lot from chatting with you. It's been so fabulous. I really appreciate your vulnerability and openness, and I'm excited for what's to come for you. And I love that in the immediate what is to come. It's prioritizing your family and your personal life. And you referenced a fiance when we were talking earlier. So that's awesome. You have exciting things ahead of you, and we can't separate our personal lives from our professional lives. You're a whole person and a whole human. And, answering in that way, I think is really fabulous. So I love that for you. I'm excited. I hope we get to stay in touch and I can
Yeah,
see
I would love that.
where you end up, because I'm just so glad to know you now. Thank you so
Yeah,
much for being here.
I appreciate it. Thank you so much.
Thanks.